Welcome to another episode in our series on COVID-19, Science in Context. I'm Stephen, and joining me today is Professor Neil Ferguson. What do we currently know about the impact of schools returning in the last few weeks is having on transmission and cases?
We're not seeing a rapid increase in case numbers associated with the opening of schools, though we're seeing some increases in both from the Office of National Statistics Infection Survey, certain areas which opened schools earlier. We're seeing increases in infection rates in school-aged children, but it hasn't propagated through to the wider population. The challenge will be as we head into the autumn and winter, we would expect indoor mixing to increase, and we're still not at normal contact levels, but we'd also expect the vaccination currently rolled out in the country, the protective effect of that to wane very slightly, and so there is likely to be some upward pressure on case numbers.
Do you think the vaccine booster programme will be enough to keep winter cases at a manageable level, or should more be being done now?
Overall, case trends in the UK are cautiously encouraging in the sense that we have flat or even slightly declining case numbers. And we also have data coming through that the third dose, the booster dose, appears from data from Israel and other places to be highly effective at boosting antibodies and protecting people. So as long as we can roll out the booster program and the vaccination of teenagers as promptly as possible, and I do think we'll probably have to move to second doses in teenagers as well to get effective levels of protection against Delta, but as long as that is done in a prompt way, I'm moderately optimistic. We can't rule out some need for additional measures, but I very much doubt we will need to go back into lockdown again.
At what point do you think additional measures would need to be considered?
The thing which will drive the government is NHS demand. If we started seeing a really significant uptick in hospital admissions, that's the point where we might need to consider the reintroduction of some degree of social distancing or other measures. As I said, I don't think that would need to go as far as full-blown lockdown, but we might need to reimpose certain restrictions just to get hospital admissions down again.
Thanks for your time.
Thank you.